Hello, welcome back to Vibes with Dr. Ruth Grace. And today we're talking about, well, how well do you know your cookie? And in studio today we have
Katana
these beautiful
Chantal.
ladies. Yes.
Sorry. Miss Katana
Never apologize for going first, please. Ladies first. So she's a lady and she knows it.
Katana Chantal Samali. I am a digital fellow at Salty Plus Media Hub and an effective communicator.
Oh, Nyapende Kristen, I work with Sauti Plus Media Hub, and I'm happy to be here.
Okay, so thank you very much. For those who do not know, we snatched a few of the people in the house today so we can have this talk. And we have ladies today because, well, we want to know more a lot about ourselves, and we want to know, well, what is a cookie anyway, and how well do we know it? So ladies, Chantal and Christine, how well do you know our cookie? What do we know about it? What is supposed to be the normal? Usually we have a discharge down there. Do we know what is normal? People always tell us, oh, do you know what? You have to do this because you're female. You have to do that because you're female. So before we're going to explore all that in this discussion, and then you can share with us what you've been told, what you've had, what you think should be demystified. And also, we're going to also respond to a few questions that people had on social media. Some of them have been asking, like, I have this t-shirt that comes every month. What is wrong with me? Or I've gone to the hospital. They've managed me for a UTI, but I still have a discharge. We shall expound on all that. So yes, ladies, who wants to go first? Christina. Okay.
Okay, one thing I know about the cookie.
Yes.
It's a very sensitive part on the lady, and at some point it's the very...
Like how sensitive? Do you know that your eye is sensitive?
Yeah, it is. Okay, they're both sensitive. Okay,
Okay.
every part of your body is a bit sensitive. You get it? But when it comes to cookie, it's very sensitive.
Okay.
And I feel like it's the most important part on the
Female
woman,
body.
female. You get it?
Most
So-
important. Do you agree with that, Chantal?
It's the most important.
Well, if you guys are not able to talk today, we would not have had this podcast, by the way.
It is the most important.
Most important.
It is.
Do you know that if you're not able to talk, we wouldn't have had this podcast, but probably we may have had
Yeah.
maybe in a different format.
I know it.
Uh-huh.
But when it comes to cookie,
Hey.
guy, it's something else.
Okay, I'm out of the discussion. So, well, let's go ahead
You
and
have to
you tell
protect
us.
it like a cage.
Exactly.
Yeah,
Chantal
yeah,
is
yeah.
insisting.
Okay.
It's very important.
It's not even
Very-
tell us. It's like a hot cake or the
Without that
female.
thing, apart from children, but married people know. Even if you're not married,
Apart from children.
those things you have to.
So it's not important for children.
It is, but apart from that, you also know. So you have to guard it properly.
Properly.
Okay.
Yeah.
Like if it's dirty, if it's having, weird
Infections.
Any infections,
trust me,
etc.
it will affect your whole life actually.
Well,
Somehow.
interesting. So we talked about children not knowing about it, or like maybe children may not know anything. For those who may want to maybe follow up, we're talking about the 1% that we talked about the last session. So the 1% today we're talking about is the ladies 1%, which we're calling the cookie for today. So we know that yes, the young girls out there and the girls I have in house today are really saying it's something special. But we also know, maybe I wanted to ask, what else do you know about the cookie? Like, apart from it being very special, which I agree with, of course, it's a very special organ. Some of us call it like a special alien because yes, a special alien.
That's why
I'll
the
get
one
it
alien.
because of the way. Okay,
Why?
maybe this shouldn't be aired, but whatever. But because of the way, like it enlarges when a baby is coming out. You're like, and then in like the next 10 minutes, it's back. Yeah,
I think I saw it on her TikTok.
it just morphs, man. It just
On your TikTok, you showed something where it was like this.
Yeah.
And like the next minute, it was.
it just goes up. After that was like the cervix. That's only like parts of it. But the whole thing is, anyway, it's an alien. But apart from that, like, what else do we know? We know that well, our cookies do bring menstrual blood. We also know that, like, okay, yes, like delivery for babies. But what else do we know about our private parts? I think we know also the part of, we also make susu.
Yeah, of course.
But then do we know where the susu comes from?
Okay, about that, actually,
Yes.
let me just. Okay, it's so funny. So, I didn't know. I thought I didn't know that I have a vagina up to when I was in P6. Can you imagine? Not all alone, they used to say like, girls, you have this, you have that. So me, I didn't know where it is. I used to like ask myself, but really,
Where is the urine coming from, eh?
yeah.
Either way.
And then I remember one day I was with my friends, we were talking about those things of pulling, trying physics. So they were all on us. So they were telling me there's some things that they're like two, that I'm like, where are they?
Where are the two
So
things?
they tell me where they are. And I'm like, wait a minute.
You know,
Bible.
interestingly, the body comes in twos. So when someone says two, where are the two things?
Where
Okay.
are they? I have never
I think
seen
in
them.
a different episode we'll call a singer to talk about that.
We need
But-
those singers
We
here.
need a singers here. eh?
They have too much.
Ah.
Yeah, so much paper to
But
tell us.
okay.
on what she said, is pulling, like, is it a myth? Like, does it really do what they say it does?
What do they say it does?
Like in P6, they say those singers they were also announced about pulling. I don't know what those two things are called,
Yeah.
but like you have to like pull them with some herbs so that they like be longer.
Yeah.
For some reason. So is it like important? Like even in the doctor's world, like is it
Okay, so
worth it or something?
For
like that?
Doctor's World, no.
Yeah.
Scientifically,
Doctor's
no.
World, no.
Really?
Yes. So Doctor's World is like it's a sham, and yeah, it's not it doesn't do anything
Okay,
on our side.
they used to
So
tell
what?
us
What
that when pulling helps you, like when you're going to give birth, like it helps you keep the baby. Like actually, they told us a person who has pulled has very few chances of like being operated. It's easy for them like to push a baby, watch and those things. So they also told us that they also help like to keep you warm,
Okay.
to keep dirt from entering your whatever, your V part. And I'm like, okay.
Okay, I'll just cut you short immediately. So the answer is no.
What?
Yes. So your own cookie actually cleans itself.
Oh,
Yes, it does. You don't have to put anything in. You don't have to do anything to eat. Our cookie is very interesting, and actually, it's being studied more. And
Yeah.
what we know is that we have different layers. It's not like men where it's just
one whole thing.
that whatever that is.
Yeah.
A stick and some to egg somewhere. But like for a woman, it's more complicated on the outside and also.
Okay.
We're sorry.
It is true. I'm 21. I know these things.
But yeah, okay. So it's more complex on the outside and also on the inside. So on the outside we have what they call the mons. The mons is the outside part where the hair grows.
Okay.
That's what we usually call it in medicine. It's the first part where pubic hair grows as we're growing up as females. And then down, which some people call the lips of our cookie.
Okay, yeah.
Yes, it's called the labia. Okay, so labia is called, there are two labias.
I think
Is
that's
that
the one they pull, right?
no?
No?
These
So,
are the ones.
yes, are you interested?
That's
There's some girls who pull that and they're like, have been pulling thing. Nothing is moving.
I'm very sure that's not what I pull.
Nothing is changing. You're very
I'm very sure that's not the one.
Showing.
yeah,
I know,
so
I-
it's not
I-
that. So ideally, that other part of our bodies naturally is like that because it actually keeps our bodies warm. It naturally just does this. Even for a young baby, actually for babies even like bigger, it does like cover up that. Then when you open the flower more, inside is what they call the labia minora. It's the
like
smaller
the flower.
labia. And that's what, and that's what they do. That's what actually is pulled. Now that one is close to what they call the clitoris. Okay, the clitoris is what people call the bean. Yeah. So now the reason why actually people pull is because the labia minora is connected to the clitoris, okay, the bean, and it has a lot of sensation. So it's more about increasing sensation for sexual activity. And for some people, they believe that the longer the labia minora is, the more likely it is to also increase sensation for the partner's sexual organ as it is entering their,
But no, it's all the myths, right?
Yes, exactly. But does it increase? Well, we can ask the men sometime. If it actually increases your
Does it
sensation, please
increase?
let us know. But I don't
Does
think it does. And even if you pull, it does not keep the place closed. No, your body naturally does that. And then what you're pulling is not you're pulling inside. Your body cleans itself by releasing a discharge. And that's why every woman actually has a discharge. Whether you're in your period or after your period, you'll have a discharge. Even if you're not in your period, you'll have a what? A discharge. And this discharge changes. And what is a normal discharge anyway? A normal discharge should be clear. It should not be smelly. It should not itch. It should not burn you. It should not anything. It should not have any pain. It should not have any spotting when you're after maybe sex or maybe even like any spotting of any kind. No, that's a normal discharge. And women have, we're more interesting. I don't know if men know that, but we're more interesting. Women have different discharges at a different time of the month.
Yeah,
Wait,
exactly.
I have a question now.
Yes.
That how does the clear discharge clean? Like How does a discharge clean like?
Milango mbili gweyera. It strips
It's
itself
just
out.
natural.
Yes, it's just natural. So in there, in our bodies, we have different bacteria. Okay, so some people, oh my god, I have bacteria in my body. Yes, okay. So we have different bacteria, and women tend to have more in their lower parts. And then what happens is that this tends to kill any other abnormal bacteria that comes. So we have those fighting bacteria. Then we have the others that also just stay there. Now, in case they come because something has changed down there, what happens is now this other bacteria starts producing something, what we call lactobacilli, okay? I think you've heard about people using yogurt. It's called yogurt, etc. It's because the same acid that is produced, that makes the yogurt, is the same acid that's produced in our own cookies.
Oh.
Yes, so that acid is what clears. I can't talk kocha.
So it all,
Yeah, 1% buns.
it now
Yeah.
makes sense because
Yeah.
there is this thing of like when you're having a bit of a infection, you're advised to first take that plain yogurt. They say that it helps. Does it?
Yeah, so some people advise
because of
that.
the-
Some people actually put it down in their cookies. I'm going to say, do not put anything in your cookies, please. Do not.
Also
Yes.
another one about like baking soda. People sitting in
Yeah.
like water and which has like baking soda. Does it like work, or do we use the normal baking soda? I don't know.
No,
Are people
no.
advised to do that? Because I've had lots of people
No, you're
talk about
not.
it.
There is something else.
too much.
And if anyone has any infection, usually what we advise is that someone comes to a healthcare provider and we actually check and see what is wrong.
So even the plain yogurt doesn't work, guys.
It doesn't work, okay?
Okay.
Yes, it does not work.
babe, I want
Yogurt is
yogurt.
a very good, thick fluid to take. That it's just good for your body, it boosts your immunity. And now we're going to head there. Why yogurt is important? Why is it that
Actually,
adding is
I have a
important?
feeling the next question I was going to ask is about where you want to head.
Okay. So now the thing is this: when that you see when the fluid now is more acidic, that's why our knickers with time they get that.
Whitish burnt something.
It's like a bad something in the middle. It's normal, so don't feel bad.
I thought it's because we're buying fake nickels.
I thought
No.
it's because people wash that part like more like
No, it's
on
not
the underwear.
that. Yes, it's not that. So it's because your girl is clearing herself. She's like cleaning herself.
So you're healthy if that is happening.
Exactly. You're healthy if that is happening. Like you shouldn't worry about that. What is not safe is if that discharge starts coming and you start feeling any pain, then the discharge, you're like, Neda, this one is smelling. Something is wrong. Yes. If it's itchy, maybe you're going to urinate and then you feel some burning. Now, some people usually confuse what they call a UTI and then an infection from, our girl.
Yeah.
Interestingly, our flower also has different holes, okay? For now,
I thought it's only one.
get to know more about your flower.
Indeed.
How-
I'm really
how
getting
well
to
do
know
we
a lot about it.
Well, you know what you're
Let's
thinking.
continue. I'm enjoying this.
Okay, so good. So now we have actually more than two, but for purposes of this session, I may
We have
talk
more
about,
than two.
Yeah.
First, be attentive
We are
properly.
Gloria.
Okay, so there's one where the pee comes from, okay, where the urine comes from.
Okay.
So usually it's just above somewhere, okay. The bin somewhere, and then there's just there like a hole. It's very tiny, and then after that there's a bigger one where actually our menstrual blood comes from. So I think that's the day you discover like, there's something else.
Is that where the baby comes from as well?
That's where baby also comes from. Exactly. And then for some people, water, yes. And some people who also have some other holes in there, okay?
Where?
In the flower.
For the water.
In the flower.
Hey guys, seems
Yeah, so every normal human being actually has those, human being who is female has those little holes in there. And they produce a discharge that helps to lubricate your vagina during the activity. We'll talk about some other time.
okay.
Exactly, yeah. So they produce the,
That people should stay tuned
Eh,
because
so people should not.
We're going to tell you where Zama waters
we are
come
just
from.
touching
So
the
don't say
surface.
me, I was not white. No, your own body produces that extra lubrication for you, so you don't get hurt during during sexual intercourse, and then it also produces it so that it can also help the sperm move and you get pregnant. Yeah.
babies.
Yeah, so it's amazing. So in case a woman is dry, that will be another session, I think. Back to our girl, okay? Now, when a woman is giving birth, okay? So someone, because you asked earlier, is it actually important in giving birth? Manga, I've pulled, I've what? The answer is no. We actually tend to get more women who tear. If they pull their labia minora, that small part, they pulled it so much, they actually tend to tear. But omwana wafuluma, bakalega, it becomes as thin as like a polythene bag, and it just starts tearing. It's the most painful part to stitch.
Oh my God.
Bakuwadde wuzi naye wuzi we baziwadde walala nnyo. It stretches so much. Some men are actually grossed out by it, so it depends on someone's partner. Some men are grossed out by it. We've had instances where a man walks in, si bazungu bokka n'abaddugavu, where they walk in and then they say, I think my wife is abnormal, please help me and maybe do a surgery on that. And it's interesting because is it a bad thing to do? The answer is we wouldn't say yes or no, because I feel, for me, in my perspective, I don't know what you guys think, I feel like someone should choose to do it. Not the things of someone waking up. I'm told in primary schools, they used to wake people up in boarding schools and then they put them in a field.
Yeah, like girls, let's go.
I think that should be like some sort of harassment of some sort.
But even parents need to like consent as well.
Yeah, I think so. And I feel like someone, if you grow, then you can choose and say, I want to do this. For me, I don't think it should be like a coercion sort of thing.
Too.
Exactly. It could be important for you if you believe it is. And people actually, other African cultures have contested it and said, Neda, this is not FGM. It is our culture practice.
Now also people being self-doctors, like
Like, the women actually removed it. They were like, no, WHO, please, this is not FGM. It's a culture practice and we appreciate it. And I feel like that's okay. It's a culture practice. If someone really wants to do it, go ahead.
Let them go
Does
ahead.
it help with giving birth? The answer is no. Okay, your baby comes from the other hole where your menstrual blood comes from. God designed it for it to be able to stretch as much as it can for your baby to come out. So whatever you're pulling does not have any association with where the baby comes from. So as we are almost closing up with this session, well, I wanted to also highlight a little bit about the other discharges that may be abnormal. Okay, which ones have you like had? Wale wantu bagamba simanga nti wenyambala knickers, when they're cotton knickers, or there are new ones. I don't know if you guys have seen them. They're not. I don't know what they are called. Maybe they're called cookie holders. I don't know what they are called.
They're called cookie
It's just. It just spam.
I was like, wait a minute, what is this?
they refuse.
They refuse.
Some things are too much.
But the goal is to have the discharge content. So
That's the
now
whole thing.
the whole thing
Like
is
that's the whole thing. And covering part of
Yeah. So some of them also cover like 20%. Some of
the other
them
one is not even
for
20%.
advertising.
The other one is like
5.
yeah, it could be. Yeah, I think they could be comfortable.
But the way I saw them, it's like as if
I mean,
they
it's like
even have
wearing
like
a thong.
metal.
You know, at first, like someone sees a
Yes.
thong and they're like, oh, it's
Yes.
very uncomfortable. The moment you like
But
wear
for a
it,
thong, it's something else because it comes like this. Now the other one,
it comes
it's
like this, but also like has that one line. I can go
Yeah.
inside, like, and you feel very uncomfortable about it. If you think about it, but when you wear it, you're like, I'm actually free.
So people
Yeah.
talk about
Anyway,
also
we'll
like,
see when to try those. But the whole goal is, do they increase your infections? Do they increase any?
That's the question.
The answer is they don't.
They don't.
Yes. Usually we encourage personal hygiene, like wash up. Our private parts, like I've described, the ones where the hair is, and also like the other majora where it's big, the lips, they all sweat because we have hair. So we sweat. It's normal to sweat, normal to have what they call like oil from your skin. So what happens if you do not wash up and anything? Now those things now start attracting the bacteria that starts coming up. Now remember, our private parts are open, okay? Yeah. Amazing for us, we're just open. So they're open. Now what happens is now the bacteria starts growing. It now starts disturbing the other normal bacteria inside. Now what happens? Your girl starts complaining and says, So now the bacteria outside are trying to fight. Now they produce a more discharge. So that you realize, discharge nga yeyongedde. The next thing you know is, Now when you start itching, it's because now the skin of the vagina is trying to heal itself, but then it's also fighting. So you're like, now I have some itching. Now I have that. So we advise, if you have any knicker, please just have your personal hygiene. Wear whatever you want to wear. That's okay. As long as it's clean. And when you're younger, of course, it has cotton knickers are good. Cotton knickers are good because they're good with absorbing moisture.
okay. So you know, like sweating, like on the side. Okay.
Exactly. So if you're sweating, the way easier. And if you're younger, because people who are younger in primary school, they're more active, etc. So of course, the senior women teachers are going to be like, yambala cotton knicker, take a muka petticoat to help you.
Yeah.
And then also the other thing is that when you're young and you have a crash, so the fluid down there, you're not able to control it sometimes. Sometimes you may actually get an excess discharge. Not because it's bad, but because it's just normal. And it just comes up, and then they find themselves wetting their underwear. And that's why young people, the younger children, primary, secondary, are actually advised to wear a petticoat inside.
Petticoat, yeah.
Not because the school is too local, it's not too what. No, it is actually save you from the embarrassment.
Me, I thought actually the petticoat helps you like when you're like having the whatever knickers, those colored knickers. Like it helps you like keep your
Like the see-through
Yeah,
thing.
see-
It actually helps with that as well because it's also self-respect. And you say,
Yeah.
okay, fine. Do I want to walk around the whole school with like
No way.
everyone defining how my butt
Yeah.
looks
Yeah.
like? So the answer is no. So yeah, it actually helps with that as well.
Even like when you're sweating like on the thighs, having a petticoat is like also hygienic.
Exactly, yeah. It's way better. And I think if you notice, like if you wear petticoats that are these other material,
silk.
I think silk, I know that's other smooth material, definitely tend to smell. Like if you don't wash them every day, they tend to smell. Whereas the cotton is like, yeah, I'm doing my job.
By the way, I have
It's
a
okay.
question.
I can bear.
That you have talked about petticoats. But there's some people in high school, girl, like they spend the whole day in bikers, like 24/7. How healthy are those things? Because some people really just do it
Then
too
cause
much.
like
Yeah.
don't you start smiling? Because
Just-
you need to
what
hair
we-
it and all that.
Let the girl breathe.
Yeah, let the girl.
We need to tell the girls that let the girl breathe. Osago mchala, oyamba dempale kumacha. At night you're still wearing something.
Where's
Chichi,
CBA?
where's CBA bichi?
Too much.
Let the girl breathe. And also when you overwear bikers and you like have them day, night, etc. You're making time for all the sweat to pile up and everything. So what happens is that now, and then the other interesting thing that now you wear a biker today and also you wear it tomorrow. Yeah,
Yeah.
that part. Then the next
Rebounding.
day.
Yeah, rebounding.
Congratulations.
Has to work.
So whatever and in infection, I never said UTI. Oh,
They don't even come when they're wearing a biker. That day.
So it's okay to wear your biker, but please
Yeah.
wash up, okay? Wash up, make sure you're hygienic and all that. Then, so why we described where the urine comes from and then also the other place where the menstrual blood comes from is because usually when a woman has a discharge, apart from the itching, they may start scratching on the outside, okay? On the lips. And then some other time, it may start getting as if a burning sensation if something has power that is hot because the acid is now burning there. Now, when a woman goes to pee,
acid?
acid tell you covered.
Okay. The one that
the one
causes the patching.
the patching in the knickers, yes. So now what happens is when someone is going to pee, they now pee, and the last end of the pee now starts going onto our lips, and then they start burning. So now the women say, oh, when I go to urinate, I actually have pain. And then they come to us and then they say, I think I have a UTI. So honey, you don't have a UTI. It's your cookie that's actually having a problem somewhere else.
Problem.
You're
Yes.
taking care of it.
And
properly.
the best thing to do is like they need to talk to the doctor and then they tell them, okay, so this is the problem. I've been having this discharge. I've been having this what, and when I pee, this is when I feel pain. So how you feel pain when you're peeing makes a lot of sense for the doctor. So you have to inform them, and they can be able to advise you and tell you, Neda, I don't think you have a UTI. I think you have an infection of somewhere else. And not every infection that comes from your cookie is an STI. Most people are like, oh my God, katina infection ni, or neda. Sometimes infections just come. Sometimes it could be something that you're using. You've changed maybe a condom, or sometimes even used a condom. Some women react to condoms and actually have a lot of discharge after that. It's an allergic reaction. It happens. Other people, it's because they're douching. You know what they call douching?
No.
Putting fingers in holes where they shouldn't put them. Yes, your body cleans itself. You do not have to put a finger anywhere. Then now there's this thing people use. I don't know if you've heard about them. Sweeteners.
Sweeteners.
Others
Oh.
call them. They even have different.
They are
scents.
flavoring their cookies.
They're flavoring their cookies. Manga rosy, chocolate, banana, rose chocolate. Those things will just make your cookie cry. And now, unfortunately, when girls like get that abnormality, that smelling weird, they run to those.
Yeah.
So now when you run to that, you're just worsening because the bacteria in there is supposed to be normal and supposed to be available. When you add something else that is different, what happens that now the bacteria is now fighting. The next thing you know is Nina discharge take oma. I've used this, I've used that.
Exactly.
And then the other problem is someone now goes ka drug shop. Nina infection mpayo ni dagala. So they just prescribe for them themselves. Not knowing, the more you actually use antibiotics, the more you're more likely to actually get what they call candida. Yeah, because the antibiotics are killing the bacteria. So what happens? The body says, dinda ko katia something else. Now you end up getting a yeast infection. A yeast infection and a bacterial infection are very different and are treated differently. Yeah.
So I've had people say like there's some juices that are better. Like If you take, I've had maybe one of cranberry juice.
Yeah, so
Like-
cranberry is very good, but for your urinary tract. Urinary tract, remember the hole that brings urine? It's called the urethra, okay? So it opens up into what they call the bladder and then up to your kidneys. So urine is kidney and all that entire system. So cranberry juice is very good for your kidneys. Is it good for your cookie? Well, any juice is good for your cookie as long as you stay hydrated, but it's not really going to manage your infection in your cookie.
Okay, so do you advise like girls like going in for steaming and all that? Because I normally say
I'll tell you my own story. I went for steaming Sunday.
what was
My girl
happened?
complained. I think the following day, oh my God. It's like as if I had, no. The girl complained. She said, no, it is okay. Because I wanted to try it and see so that I have a standpoint. Like, let me try this. And I talk from a standpoint where I'm informed. My girl complained. I think I got a bacterial vaginosis. It's like an abnormal disease that comes. It's smelly. The next thing I know, I'm feeling pain. I'm like, what the hell? So I went on a whole course of antibiotics. And I said, you know what? Thank you so much.
That's not.
That's no.
Sit down.
I tried it. If you're trying it, it's working for you. Continue.
okay.
Nae for me.
And sauna, like that stuff, is it also like?
Sauna, well, do you steam your cookie? And I feel like the body keeps itself warm. You're not going to wake up in the morning and tell your body be this temperature
Yeah.
or be this temperature. So we are born naturally warm down there. So no one is going to tell you, Smanga, when you pull, or when you steam, or when you watch, you're clearing, nah, you're not. The body cleans itself. If you feel like you're way better when you do it for you as a self-care thing, but it's not doesn't really like improve much. And be careful when you get those infections as well.
Yeah.
Adding on that also, like you also talk about like how long should your knickers work? Like how often should you like change?
Like, you know, at least
Okay.
but she's 3 months. So how, yeah.
So surely I think Anika is like 3 to 6 months is good. Like just change every 3 to 6 months. Just change because by 3 months you'll start noticing it's already getting worn out in the middle. Yeah. So 3 to 6 months it's okay. Just have a shift. I usually tell the girls like it's very easy to buy a Nika every 6 months rather than throwing everything out at the same time. And then they're very expensive.
Very.
Very.
They are too expensive.
Yeah,
these
very
days.
expensive. So now, how often should you change a panty liner? If the good thing about a panty liner or a pad is it does not enter your cookie. So it is safe to leave there. As long as it is not full, it's not smelling, you can change. After 6 hours is a safe time to remove it. Okay? After 6 hours or after 4 hours, whatever makes you feel comfortable. But usually you expect if you're wearing a liner or a pad, maybe at least every 6 or 8 hours you can change. Some women, we should talk about menstrual health on a different episode, but we should talk about how often you should change your pad, etc. But maybe I could mention this also because we're talking about the cookie. People who use tampons,
I was about to ask
yeah,
about those
please
ones.
read on the labels. It clearly says every after 4 hours you should change your tampon because that one goes inside. Okay, so what happens when it goes inside? Also, it collects the blood, yes, but also accumulates bacteria in there, and bacteria loves very moist places. Okay, remember we're already moist. Now there's more moisture and there's nothing coming out. Naturally, things are supposed to be flowing out. So for that, every 4 hours, you actually have to time yourself and go and remove it. Some girls tend to leave them there, but then the day you get a certain infection that is very bad, even write it there. I'll just say it's a quadruple S infection. Okay, it's a very bad infection. It actually like can kill you, can get septic shock. So yeah, but because liners are out, that's okay. And if a girl out there has like a heavier discharge during the time of a month, maybe when you're ovulating, it's a heavier one, it's okay. Please wear a liner. It's safe for you. It's okay to like be safe and hold this in.
Yeah.
Thank you. So I think we can close the session, girls. I don't know if there's anything
I've
else
really
that you
learned.
wanted to add.
I've learnt a lot in this episode, that's for sure.
Okay, that's cool. So for those who want to know more or have any questions that we have not yet answered on this session, please kindly follow us on our YouTube channel and also on the TikTok, on my TikTok at Dr. Ruth Grace, and she'll be able to answer your questions. Type in the comment section and let us know what else you want us to talk about. What should we teach about? Is there something that we left out? Or do you actually agree with us or you don't agree with us? And yeah, and if you do not agree, please come up. It's not a debate or anything. It's a conversation, and we're here to also give you the facts on a medical standpoint. And yeah, thank you very much for watching.